Thank you very much. And from what I gather, it's something that people from a variety of disciplines in which they can engage. Actually, I think you're next after. Yes. Yes. Excuse me. So our next presenter is from a field that, for anybody who's followed the rise of chronic disease, it's quite important to all of us. It's nutrition and dietetics. Katie Eliot is with the Academy of Nutrition and Dietetics. She's a registered dietitian and has a doctorate. And looking forward to hearing what your field is doing in the interprofessional world.
Great, thank you. And really, I am excited to be here today to represent some of the work that myself and Dr. Kathy Kalasa, who is turning over the seat here to me. And basically, what I'm going to do with my presentation today is kind of share with you a snapshot of where we stand in terms of interprofessional education in the nutrition and dietetics field. I think with anything in interprofessional education, it's important to have a good working definition of each profession. And so I wanted to start today with a brief but rich statement about what it is that registered dietitian nutritionists do. So I'll quickly read to you from the Academy of Nutrition and Dietetics, their definition of the registered dietitian nutritionists are the food and nutrition experts who can translate the science of nutrition into practical solutions for healthy living. Registered dietitian nutritionists use their nutrition expertise to help individuals make unique, positive lifestyle changes. We see registered dietitian nutritionists on many healthcare and health prevention teams. Just to list a few that you see here, where you might have seen a registered dietitian nutritionist: eating disorders, heart disease, diabetes. And we know that these team members need the soft skills for effective teamwork and interprofessionalism. But our question was, are our students receiving this education? So quickly before I talk about the results of our search, I did want to mention the education pathways for the registered dietitian nutritionist. And we basically have two pathways. One is with the bachelor's degree, where the didactic program in dietetics is built in. Our food and nutrition courses, our basic sciences, also courses like psychology and some general education requirements as well. Students at that point can apply to and be selected for very competitive supervised practice programs where they'll spend 1,200 hours in direct education with preceptors, otherwise known as the dietetic internship. Another pathway, which is less common, is that the coordinated program would include both the didactic program in dietetics and the supervised practice. One thing I should mention at this point is that a proposal has been made that starting in 2024, that our profession would be a master's prepared profession in order to seek the registered dietitian credential. So one of the first places that we started was looking at the standards from the Accreditation Council for Education in Nutrition and Dietetics, looking at which of our standards actually approach the content of interprofessionalism. And we found that only 2 of our standards reflected this in both our core knowledge at the didactic level and then in the competency at our supervised practice level. So then we went to the literature to see what was being reported in the literature as far as nutrition and dietetics and interprofessional education, and found that really, as far as nutrition and dietetics students were concerned, they were only being represented as smaller parts of larger groups of professions when being reported in the literature. But what we did see is that nutrition and dietetics students are interested in and ready for interprofessional education. And I know that I can speak to this from my own experiences with my own students. However, we found that there was really little known about the level of IPE participation among nutrition and dietetics programs at large, and also the benefits of interprofessional education to nutrition and dietetics practice into patient outcomes when team-ready dietitians were on teams. So next we went to our colleagues. We sent messages on our electronic mailing list, and we also reviewed abstracts from nutrition and dietetics conferences to find out how exactly our colleagues were participating in interprofessional education. And we found what I'm sure is similar to other professions, that really it varied from limited interactions in case studies or half-day, maybe full-day workshops, all the way to a program that is offering standalone interprofessional courses as part of their curriculum. We also took a look at which professions are nutrition and dietetics students participating in these experiences with. And of the programs that we looked at, interestingly, all programs were interacting with nursing students, and then all but one were interacting with physical therapy students. We also found that there were some other interesting pairings, such as creative arts therapy and genetic counseling, which I think is interesting. One of the challenges, which I'll discuss in a moment, with nutrition and dietetics programs is the type of academic unit that they might be housed in potentially could limit the health professions they have the opportunities to interact with. We also looked at interprofessional education as experiential learning. One of the topics that was brought up at a previous workshop was the concept of faculty-assisted, student-run interprofessional clinics. And what we found in discussions with other educators is that very often nutrition and dietetics is available to be a part of these. And with large number of patients with nutrition-related health conditions that tend to come to these clinics, the importance of these students being there. The students who are participating say that this interprofessional experience helps them to become team ready. But of course, with anything, challenges such as institutional support and of course, fighting for time in the curriculum with those accreditation standards. Some of the good news is that we do have Academy of Nutrition and Dietetics support for interprofessional education, obviously being here, having a seat at the table here. And also a task force was developed within nutrition and dietetics educators and preceptors, a subset of the Academy of Nutrition and Dietetics, to get the message out and to gain support with and for educators. We've also gained support in the dissemination of information, having a manuscript that was accepted and is in press, and then also having announcements to our members weekly electronically about activities among interprofessional educators. In February, a document was released by the Accreditation Council for Education in Nutrition and Dietetics entitled "The Rationale for Future Education Preparation of Nutrition and Dietetics Practitioners." The moment the report was released, the first thing I did was search and find the word interprofessional. I was thrilled to find that it appeared 14 times, and here are three brief examples. But I think the final thought from this document is that it's being recognized that there's a growing importance for healthcare professionals to be educated to work more interprofessionally, and that this message is being received loud and clear among the nutrition and dietetics community as well.
Very nice. It's great signs of movement in the field, and familiar with it with some of the fields with which I've worked too as the engagement deepens. I'm curious as that happens where you're seeing, I think particularly looking at the community environments we've been talking about here, what the roles of your discipline might be on these teams in the community and clinical environments.
Great question. Thank you. And I think it really kind of circles back to that definition of what the registered dietitian nutritionist does, and understanding that, you know, the outcomes that we talk about is for the patient or for the person, and that food is really at the foundation of what every healthcare professional wants for their patient. It connects how the individual interacts with their medicine, with their environment, and being uniquely trained to facilitate behavior change when it comes to food. It's kind of cliche, but I still remember someone saying to me once, it's harder to change someone's diet than it is to change their religion. And I think just looking at how complex our food environment is, whether it is the overnutrition or the undernutrition that we're discussing, is that we are uniquely trained to facilitate those changes. Yeah.
Katie, thank you very much. One of the things we've discussed this last couple of days is sometimes structures get in the way, and I'm wondering, in our School of Public Health is where our Nutrition and Dietetic program is housed. Are you housed within the health sciences or most of the programs? Because sometimes, like social work, if they're not on the campus with the health science schools, then they may or may not participate in the IPE activities.
Exactly, and I think that is one of the challenges that we're looking into right now is for those programs, many times nutrition and dietetics is in failing consumer sciences, and there may not even be a health field on even that campus. And so I think that requires us to have that unique, thinking outside the box, looking at collaborations. I've been really excited to hear people discussing interprofessionalism among fields that aren't even technically in that true health science. So that's definitely something that we're looking at. Thank you.